My name is Sean Hillier. I am a Mi'kmaq faculty member from the Qalipu First Nation on the southwest coast of Newfoundland. I am an assistant professor in the School of Health Policy and Management in the Faculty of Health at York University. I'm also the special advisor to the Dean on Indigenous Health and Initiatives, and I serve as a research scientist at the Centre for Addiction and Mental Health in Toronto. So, One Health has an interesting connection for many Indigenous people. While not a term that we actively use, the term One Health has historically been used within Indigenous communities as our basic understanding of way, knowing, being, and doing. And so, One Health to us is our connection to Mother Earth, to Mother Nature, from an environmental perspective. And then everything from the environment feeds to the animals. And then we have a responsibility as humans in our human health to ensure that we take care of the animals and that we take care of Mother Earth. And so I think it's a little flipped from conceptual human health to animal health and environmental health to an understanding that we as humans have a responsibility to the environment and to Mother Earth, and then to the animals and then to ourselves, and that all of those have to be in balance and in sync with one another in order to have this holistic or One Health approach to understanding the world. What's really exciting about this network is the perspective that they're taking around equity, diversity, and inclusion from a global governance perspective when it comes to both infectious disease and antimicrobial resistance. I think that it's one of the areas that substantially gets left behind in these discussions, and that many scientists and social scientists, clinicians struggle to properly identify, understand, and then implement EDI within their research and within their clinical studies. And so this network will give us the opportunity to engage both with Indigenous communities through an Indigenous advisory circle, as well as an equity, diversity, and inclusion task force, to really engage at all levels through the network what it means to incorporate those perspectives within research, within the priorities of what we're going to do, that will then hopefully translate itself into final products that have an impact on the world and how we govern ID and AMR. So some of the challenges that we face on a large interdisciplinary or transdisciplinary research project or network are certainly trying to create the understanding, especially from a social scientist perspective and somebody who intensively does Indigenous-based research and who doesn't work with Indigenous or who works with Indigenous knowledges and ways of knowing and being, is really trying to get other colleagues to understand the importance of those perspectives within their research, and really conveying across the spectrum that we can include them, that it isn't too much work, and that the end result of including equity, diversity, and inclusion within their research will only benefit the outputs that they are seeking to have, and to have a more robust approach to what they're doing. And along that kind of same spectrum is that the benefits to working in a group like this is that you have a diversity of opinion, that we're not isolated into our own silos of what we know and understand, and that I've been kind of engaging with lots of people who have changed the way I think of One Health, and I've been able to work with them where they were like, oh, I work in a science lab, and EDI doesn't necessarily come up in that field, to really change that perspective, to show them that no, actually, it does, and these are the ways that you can incorporate it, or to look at it, or to change your research questions in order to take this into account. That creates a more robust output for everybody that has the benefit for society, and really we're getting the most out of our money that has been given to us by the Canadian government.